Welcome to the Quality of Life podcast, where we explore how hospice and palliative care may enhance quality of life for patients living with a serious illness. Here is your host, hospice and palliative care leader and educator, Dr. Millicent Burke-Sinclair.
Hello and welcome to the Quality of Life podcast. I'm here today with Maureen Williams, Four Seasons Director of Care Navigation and host of our live Facebook show called Ask a Care Navigator, also known as Mondays with Maureen. Thank you so much for joining, Maureen.
You're welcome, and I'm delighted to be here.
Oh, I am just so glad. You know, I would love for our listeners to get to know you a little bit more, and so I have a question that I think that can help us do and connect with it for today. So as we think about advanced care planning and how advanced care planning can be so beneficial for the individual and their family, here's a question. The daughter of one of your clients described you as the cog in the wheel that keeps all aspects of care working together. That's a pretty huge compliment. Could you share your background and also tell us how you came to be a care navigator?
It's from a long, wonderful journey. So I'm a registered nurse by background, and I've had many years in the world of hospice care and home health care as an educator, an administrator, and a researcher, and a staff nurse, and on and on and on. Well, while here at Four Seasons, having advanced in various parts of our 14 counties, many parts of our 14 counties, we began to craft this program that we now call Care Navigation. It was in the context of how do we help caregivers? What do caregivers need? Caregivers are usually adult women ages 45 to 64. What do those women need if they're going to be taking care of parents or aging grandparents? And so Four Seasons birthed navigation out of that many years ago, actually, and it was being refined. And at some point, I believe it was you, Millicent, who's, Maureen, would you lead Care Navigation? And so I came out of the hospice world, and we started this program, really initially focused on how do we support the needs of adult daughters, ages 55 to 64, who are caregivers for parents and loved ones. So that's how it began.
I just love that tree because when you think about it, so often people are wondering, do I do? And how do I even go about accessing any type of support when I've been given a diagnosis or a loved one has? And so I wonder if you were to think about care navigation, and one of the things that you do of connecting people to the right care at the right time is educating them about advanced care planning. And when I think about advanced planning, I'm thinking about it's connecting with their wishes to their priorities. And so could you talk a little bit about advanced care planning? How do you support, and what type of impact might this make?
Oh, I think advanced care planning, y'all, is the best gift that we give to ourselves and to our loved ones. Now, let's just break down what that means. Advanced care planning. It's not advanced care, it's advanced care planning. You're planning for your care in advance of your needing it, or should you need it, and be unable to make your own decisions. That's what advanced care planning is. I'm making my wishes known in advance. Should I become incompetent or incapacitated, or both, for whatever reason, be it temporarily or permanently, someone will know what my wishes are. Advanced care planning in that context permits us to designate someone or delegate to someone who would be our decision maker should the need arise. And in the state of North Carolina, that person is called a healthcare power of attorney, or you might hear it as a health agent or a healthcare proxy. It has different names across the country. But in the state of North Carolina, it's called care power of attorney. And that only goes into effect when I or you or whomever becomes to make his or her own healthcare decisions. Up until that time, we're our own decision maker. And so I think that's so powerful because my wishes are known and I trust the person making those decisions. So because I've selected someone whom I trust and I've shared my wishes with that person, well, then that's a good formula right there for someone to support me or you or whomever should the need arise. And honestly, I think anyone who's at least age 18 should have a healthcare power of attorney, an advanced care plan, something that says, here are my wishes should the need arise. So that's the beauty of advanced care planning in my perspective. And actually in the state of North Carolina, there's another form called Allow a Natural Death, also known as a living will. And that's these are two separate documents. They can sometimes are combined, but that's where what my wishes are, not just the person who's going to carry out my wishes, but the what. What are my wishes should I be faced at end of life with those kinds of decisions? And there it is. I tell the story often, and now I'm putting it out here in public, that I once took an end-of-life nursing education consortium class. And one of the topics was we had to craft what our bedroom looked like at the end of life. And I had a window, and I had flowers on a table, and I had people around me, although I don't draw, they were all stick figures, and I would label them, and there was my bed with my dogs on it. And on the television, I still have nonstop episodes of Andy Griffith showing. That's important to me. Those were my and still are, my end-of-life wishes. It's what's important to me. Some people might have music running. Some people might want to have certain scents. It's what's important to me, and that's what a living will permits a person to do, is put his or her end-of-life wishes in writing on paper. So advanced care plans, those are advanced directives, decisions we make in advance about care should the need arise.
You know, one thing that I love so much about that is each of us, if we think about it today, have wishes. If we come and need to make a decision, we'll normally be pretty comfortable to share what's on our mind or what we think is important. At Four Seasons, we believe what's important to those that we're serving is likewise important to us. And so what a great opportunity to say, hey, we can help you identify what is most important to you, both now and then later, of course. But when we do that, especially comes to that point in time where they're unable to speak for themselves, getting that in writing. And I love that so much about the benefit of advanced care planning. And sometimes, you know, like let's say that someone says, well, I just got a diagnosis. I don't feel like I'm even ready to have that conversation. Well, there's still benefit in talking with a navigator, because a care navigator can help you think through things that you might otherwise think about, and then provide the support for you or your family so that when you're ready to provide that thought in advance. One of the things that I would say that's been so beneficial is when I did that, it made me start to think, okay, what is most important to me? What do I want to be sure to capture at that point of time where I may not be able to speak, right? And so that brings up another point. So advanced care planning, sometimes people might say, well, I've heard about this thing called a MOST form or a DNR. What is that?
Great questions, and I'm going to differentiate those from advanced care plans. They're good first cousins to each other. Those advanced care plans are your wishes in writing, so someone follows them out. A DNR, or do not resuscitate, and a MOST form are medical orders. They're first cousins to what I just talked about, so let me peel that back. A do not resuscitate order is a medical order. In the state of North Carolina, it is intended that should my heart stop beating or I stop breathing, I do not wish to be resuscitated. I do not wish to have cardiopulmonary resuscitation. That's all that a DNR means. And because it is a medical order, it must be signed by a physician's assistant, or a nurse practitioner, people we call providers. I can't sign that. You can't sign that. No one else. And it has to be on this bright goldenrod colored form. Well, another cousin to that form is what we call the MOST form in the state of North Carolina. And MOST stands for Medical Orders for Scope of Treatment. Medical Orders for Scope of Treatment. You hear it right there. It's a medical order. And this document exists in all the states, but frequently by different names, and it may have different intent areas. But in the state of North Carolina, this bright peptosmal pink form exists with 5 topic areas that are medical orders that you and your provider, physician assistant, nurse practitioner, can craft in advance and just say, here are my medical orders, my wishes as medical orders. Period. So I want to go over those 5 hot button topic areas. And when I'm discussing advanced care planning with people, these are the 5 hot button topic areas. The first one has to do with cardiopulmonary resuscitation. So yes or no. Then that becomes the same as a DNR in that case. The second hot button topic relates the scope of interventions should you become ill. Do you want the full scope? Go to the hospital, ICU, all the bells and whistles possible. Sure, that's fine. Or maybe more moderate expectation. Now go to the hospital and you try some of these things for a limited period of time. Or maybe it's just comfort measures only. Stay at home. That's the second hot button topic area. The level of life-sustaining treatment. And that has meanings for different people, but you can codify it in a medical order here. The third hot button topic, believe it or not, relates to antibiotics. In my hospice life, I saw this times. One is, on the one extreme is give me all the antibiotics I need to live well, to be comfortable, to be free, whatever. Treat every infection. A more moderate level might be treat me with antibiotics for a period of time, which is fine. Or the other, some people feel very strongly, no antibiotics whatsoever. We'll respect that. But now it's a medical order. The fourth hot button topic, the last two are probably the most painful, intense conversations to have. The fourth one is related to IV fluids and hydration. And a lot of people feel very strongly, IV fluids all the way, don't withhold any for any reason, or some might say take a more time-limited approach, or some people feel very strongly, particularly at the end of life, no IV fluids. That's okay. We'll respect your decision. And then the fifth hot button topic has to do with artificial nutrition, feeding tubes. Some people are really passionate about that. One might be, please give me a feeding tube, sustain my life as possible. That's fine. Some might want to have a feeding tube for a time-limited period of time so you can heal from a certain. That's fine. And some people feel very passionately, no feeding tube whatsoever. Once you and your provider have discussed that, and we have many providers in palliative care here at Four Seasons that are very competent to discuss that, and in our hospice team, then you sign it and your provider signs it. And I tell people, this is you telling your doctor what to do. And it really becomes that sort of thing. It's just there. It's there as a medical order. So that's a most in a DNR. And you can see how those are cousins to an advanced care plan or advanced directive. And I want to get a clarifying piece because I see this a lot in my practice when I'm talking with people as a care navigator and trying to help them craft plans for the future. What are your wishes about cardiopulmonary resuscitation? And they'll tell me, well, that's in my paperwork. I said, oh, you don't want to have a resuscitation? No, I don't want to be resuscitated. I said, tell me your goldenrod form. Well, it's in my advanced care plans, in my advanced directives. And I tell people, you may have those wishes there. However, our emergency medical services personnel are looking for the goldenrod or pink form. And in the absence of that, they will resuscitate you. They have to by law. So that's why these conversations as a care navigator get very interesting, very important, because then they may realize they make one more step to codify in pink or goldenrod some of their wishes.
As you were talking about that, it made me think about steps that we all take in life, and especially when we have a serious diagnosis or we're aging. And sometimes those go hand in hand, but sometimes they don't. So at whatever stage of life you're in, if you or a loved one that you have in your life has a serious illness, it's really important that you feel like and that you really do have someone that can help you. And so could you talk a little bit about, for those listeners on that say, like, I think I have a need, but I don't know what to do, could you share just a little bit how a care navigator such as yourself could help them?
Right. I fielded phone calls about that today. Some people just don't know what they don't, but they know they need some help for some reason. So what we do at Care Navigation, or my professional association calls it Aging Life Care Management, is we help people navigate the healthcare system. And I'm quite open because it's confusing to all of us, including those who work in it, that includes myself. It gets incredibly confusing. It's overwhelming, that term I hear from people. So I'm a registered nurse, so I'm able to help navigate people through pieces of their health care. It might be having planning conversations about advanced care plans or emergency plans, or what are your plans? Do you have financial plans? Do we need to get you connected with advisors? So what are your plans? We have lots of conversations about plans. Lots of times people are calling me saying, we just had a new diagnosis. Mom clearly has dementia. She's having some behaviors, and we just don't know what to do with it. What resources are out there? And I had that conversation this morning. So we connect them with community resources. Or it might be that people need to make a life transition. They need a community in which to live, or downsizing, or maybe it's time for assisted living. Nursing communities, we can help walk them through that, taking far time than it would take people who are cold to this process who have no idea what this is. And we do a lot of what we call advocacy, particularly healthcare advocacy. We will accompany people to medical appointments or show up at an emergency room if that's the case to make sure that our clients aren't left in the corner unintentionally. I'll give them that. But when we go to medical appointments or even dental appointments, we make sure to ask all the questions and lots more, and make sure we can craft that plan to have where the interventions are implemented at home. We do a lot of educating people on their options and accepting their choices. And we do this here at Four Seasons because not only do we want to get people to the right care at the right time, but because we believe that's the right thing to do.
Talk about the right thing to do. If you're a listener and you say, wow, this is really speaking to me, we want you just to reach out. All you have to do is call us, or you could go on our website if you'd like to. I'm really grateful, Maureen, for your time today and for sharing with us, because regardless of what stage of life, we all need to know that there is help, there is hope, and it's just a phone call away, right? And so I want to say thank you, and thank you to our listeners, because we don't want you to have to feel like you're alone as you're venturing whatever season of life you may be in. Just know your seasons, and we'll either help you or connect you with someone who can. So thank you so much for being with us, Maureen, and thank you, listeners.
The Quality of Life podcast is produced by Four Seasons, the care you trust, providing award-winning quality hospice and palliative care to Western North Carolina. For more information, visit fourseasonscare.org or call 866-466-9734.